Hello again, and welcome to the final video presentation within pathophysiology. My name is Kelsey Tinker, and today we're going to be going over Down syndrome. Now, this is a genetic condition where someone is born with an extra chromosome, and that chromosome being 21. It can cause developmental, intellectual, and physical delays, and it's the most common chromosomal disorder within kids. Now, each person who has Down syndrome is an individual, since the spectrum of intellectual and developmental problems is across the board. Now, the cause of Down syndrome is still unknown. Even with it being a genetic condition that's seen at birth, only about 1% of cases are inherited, and that can come from the father or the mother. Now, there is a link on the maternal side, which is the mother's age. But some people say, the older the mother, the more likely the chance that there will be a child born with Down syndrome. But about 80% of children born with Down syndrome are to women under 35. Now, there are 3 types of Down syndrome, and they're classified between trisomy 31, and that's about like 95% of the cases, where there are actually 3 copies of chromosome 21. The second would be the mosaic Down syndrome, which is more rare, and that's where only some of the cells have that extra chromosome 21. Now, the third is considered translocation Down syndrome, and that's where there are 2 copies of chromosome 21, but there's also genetic material of that chromosome 21 that's attached itself to other chromosomes. Now, it's the likelihood of having a child that has Down syndrome is around like 1 in 700 births, but that also depends on the mother's age group, because it can vary as well. Now, some of the signs and symptoms that come along with Down syndrome include some of the physical markers. So you have almond-shaped eyes that have an upward slant. There is a smaller head, smaller ears. There's poor muscle tone development. The people with Down syndrome have the ability to be extra flexible, sometimes having a protruding tongue, short neck, smaller hands, smaller fingers and feet, as well as on the palm of the hand you're going to have like a single crease. There's also the physical marker of having white spots within the iris of the eyes, and there's also the small stature, and the definitive marker where you hear about Down syndrome is having that flattened face, especially across the bridge of the nose. It's pretty flat. Now, there's also the marker of having language difficulties, as well as memory and intellectual delays. Now, as far as the prenatal screens and the diagnostic testing, the prenatal screens are more of a probability that a mother will have a child with Down syndrome. They're not 100% accurate, but they do involve a blood test as well as an ultrasound to check for those, what they call markers of Down syndrome. Now, when you look into the diagnostic testing, that's 100% accurate. You have something called a CVS test, which is more of an advanced diag test, which is where they test for chromosomal material from the fetus within the mother's blood. Now, within the 2nd trimester, they can do a test known as amniocentesis. So those are while a mother is pregnant, but there can also be preconception testing. So if a couple visits a genetic counselor, and that counselor, looking at, say, the family history and the age of, say, the mother or both parents, they may refer them to have preconception testing. Now, there's also the ability for someone to either not get tested or not know, and then at birth, a doctor will notice the physical features on a child, and depending on those physical features, may want to run, say, a chromosomal analysis, which is to confirm if that child has Down syndrome or not, and it's done through a blood test. Now, there's another blood test that's known as the FISH genetic test, and it's the same concept as the chromosomal analysis, but there's also a shorter wait time. Now, sometimes there are children that are born and physically they could have the same markers as a child who has Down syndrome, but this child is physically healthy, and sometimes having that chromosomal analysis or that FISH genetic testing rules that out to where they are a child that does not have Downs. They just happen to look that way. A differential diagnosis is hypotonia, and that can be isolated where there's a low or decreased muscle tone within that child, and that could possibly be as a symptom of congenital disease, not necessarily the fact that they have Down syndrome. Now, the outlook for Down syndrome is very positive depending on the severity of certain complications. Now, some of those complications that come along with Downs include heart disease, and that needs to be monitored, GI issues, immune disorders, sleep apnea, obesity, spinal issues, possibly leukemia and dementia, and other issues involving the eyes and the ears, so sight and hearing, as well as dental issues and possible endocrine issues. Now, because of all those possible complications, routine medical care is definitely needed. Now, the outlook for children who are born with Downs, with all of the medical advancements, children can live 60 plus years, depending on those complications and medical care that they have access to. Now, I will say that as of right now, they don't know the cause of Down syndrome, and it's mostly watching and monitoring those possible complications from the syndrome. Now, I will say, previously, I worked in special education, and the children that received PT, OT, speech therapy, behavioral therapy, and access to adaptive technology definitely benefited from that. So I will say that having early access and continued access to those different therapies, very beneficial. Okay, that concludes my last video on Down syndrome. Thank you for joining me.